Thank you, Papana. So really happy to be joining you today. Obviously, today I'm going to be speaking about the topic of e-government and healthcare from the perspective of public and private sector providers. So that's going to be my key topic. And for the audience, please feel free to contact me for any questions you might have, ideas that you'd like to share, as well as other topics. So just give me a minute to share my screen and presentation.
Sure, Manal.
Yeah. Okay, so can you see my screen? Just a short confirmation, Bhavana.
Yeah, Manal, I can see your screen. Just
excellent.
For the presenter's mode, if you can do
okay,
that.
Sure. So I'm just also going to share my audio because I also have a couple of short videos as well coming from real healthcare organizations that have worked with us on using our technology in their healthcare organizations. Okay.
Yes, we can see now. Thank you.
Excellent, perfect. So today I will be speaking about e-government and healthcare in particular. So obviously the main objective of healthcare providers is to save lives and provide care to patients. But should we really care about digitization? And today I quote Deloitte. So what Deloitte are saying is that the technology today is reshaping the relationship between patients, healthcare providers, and the health system as a whole. So it's really about changing how we work, changing the way we interact, and changing how the full healthcare ecosystem interacts, which is of extreme relevance to the government. And if I wanted to think also about key healthcare trends happening today that we see globally, so the first one is a focus on public health, especially with the COVID-19 crisis, whereby key themes have become how do we engage our populations, how do we protect them, how do we really kind of like work with them to ensure their health in the long term. And we also have other trends shaping the healthcare sector today, which is more business as usual trends. These are the patient as a consumer, the expansion of value over volume, ongoing pressures on the health system, as well as big data science. So essentially our consumers today, or our patients, have become consumers that are really ready to empower themselves with information and data. They want to read online, they want to kind of interact digitally with their care providers. And then there's more of a focus on the value that healthcare delivers, as well as ongoing pressures. So this comes from maybe the rise of chronic diseases, obviously the pandemic, as well as other types of diseases that we need to care more and more for our populations. And the final one is big data science, right? So the collection of systems today inside healthcare systems means that we need to kind of understand more our healthcare ecosystem using our data. So if I wanted to speak about regulators and public health organizations, what are best practices have we seen recently? So I'm going to share with you the case of the Ministry of Health in Morocco that have decided to use BTP from healthcare from SAP extension. Yes, so the Moroccan Ministry of Health has really kind of used the BTP from SAP to be able to view its data, really manage the crisis, and manage their steering committees in relation to the crisis. So it was really about putting a system at the level of the full country for them to be able to know what's happening, and also linking them with the major care providers they had that were dealing with the crisis. And this essentially happened last year. I'm going to give you another example, which is the state of Indiana that decided to use technology to work on a public health issue, which was infant mortality. So the problem that they were facing is that they had an above average infant death per 1,000 births that stood at 7.7, while the rest of the country was really at 7 per 1,000 births. And that's why they decided to also put in place a BTP platform using the SAP HANA system to be able to crunch data about infant mortality and also link the causes, right? So for them to view the causes and come up with solutions, they really kind of used all of the data coming from their full state. And they found, for example, things like the education of the mother, that was one of the main reasons that was linked to this high death rate. And from there on, they managed to put together a program to improve this death rate in their state. The third one is also from the US, which is the state of Iowa, that decided to use SAP Qualtrics technology to design a COVID response mechanism. And what they did there is that they really, in a matter of 1 or 2 weeks, or just a few weeks simply, they put together a way to test and manage cases of coronavirus, right? So, and they use it using a cloud-based technology. And the main purpose of that technology was really to kind of have a listing of questions that they could have their either patients or even care providers fill out, and for them to be able to manage the pathway essentially of the patient or manage the patient journey. So that's also another example of how technology can be used to automate healthcare and drive the government into an e-government way of working essentially. I'm going to move now to healthcare providers in the public sector. And the question I'm asking here is, how can technology really increase efficiency, effectiveness, and engagement, right? So if I wanted to think of the core elements of running a healthcare provider, there are 3 main things. So first of all, it's about running our operations that are clinical and administrative in a very efficient way. So it's really about making sure that our procurement is well in place, our hiring is well in place, and our patient journeys and patient flows are really kind of optimized and put together in an optimal way. The second part, and that's the most important, is really the patient that's over here at the top of the pyramid and at the center. So over here, it's really about engaging the patient in their health, interacting with them, making sure that they have a good experience as well in the hospital as well. And this really is the core reason why, for example, in the government, we serve patients and why we have government health systems to set up around this patient. As the core thing that a government health system works on. And then the third part is people, right? So healthcare is really very much reliant on people, and then we cannot really deliver care without our clinical staff and also our administrative staff that play a very strong role in that service delivery. So the main thing that we ask here is, how do in these 3 elements, how can we actually incorporate elements of technology that will optimize these 3 elements essentially? So here's an example also coming from Europe. And so we have 2 hospitals here. So the first one is from Austria. It's Ordensklinikum Elisabethen and Linz. And what they decided is to use Cerner ISH Med and SAP patient management with the ERP for them to administer their full healthcare process, right? So on one side, you have a patient record technology, which is Cerner ISH Med. That really is working on the clinical aspect of managing a patient. And then on the other side, you have the SAP ERP, for example, with patient management, that really kind of manages the administrative side of doing things. And then when you put these two technologies together, you get really a very strong level of digital maturity for that organization, and also an increased quality of care. And that's how you can run your operations extremely well in healthcare using SAP technology. The second one is the Institut Català de la Salut in Spain, which is essentially a main public healthcare provider in the state of Catalonia, with 8 hospitals and 470 primary care clinics. And they serve really 83% of Catalan citizens. So it's really an organization with a lot of patient volumes, a lot of people that actually come to this organization to get care. And then what they did by using Cerner ISH Med and the SAP ERP is an early cost estimate saving of 5 to 10%, better procurement, increased efficiency, and better supply visibility. So that essentially enables these institutions to run optimally from an operational perspective. So how does this happen in reality? So it's really bringing the best of both worlds. So on one side, you have the Cerner clinical world really that is put together with the SAP ERP solution to create an integrated solution that takes the patient from the clinical aspects to the operational aspects in the back office as well. So that's really kind of a full end-to-end system that hospitals can use to actually run. So and then the nice thing is that what benefits do we realize? Well, first of all, it's about increased patient safety because we have more transparency between providers and facilities with patient management and billing. So essentially the data of the patient can move from one facility to the other in a more efficient way, and there's continuity of service between multiple facilities. Secondly, there's also operational excellence and cost reduction because we have systems that allow us to optimize our processes and also be more consistent in the way we deliver things, either clinically or operationally at the same time. Three, it's about improving patient care, right? So with streamlined processes, we get automatically better patient care and better processes in the hospital. It also allows us to do better financial and strategic planning and better decision-making inside the healthcare organization. And then it's really about a combination with clinical technology and operational technology that's really excellent. So it's really very strong technology that we're using here. And finally, it's also a technology that can be combined with other technologies as well very easily. So it's really has a full end-to-end journey essentially for the patient. I mean, from a patient record technology perspective, it really helps in quality and continuity for patients and their care providers. It's about electronic access to information for clinicians. So the clinician directly has everything they need when they treat a patient without the need to, let's say, redo tests or take more time to diagnose the patient. It's also about improving efficiency and accuracy in delivering care processes, increasing patient safety, employee satisfaction, and operational excellence. And finally, it's also a platform. So sometimes you can actually, modify the system you have for it to adapt to the workflows that you have inside your hospital that can be very specific. So obviously in healthcare, sometimes the practice is different from country to country. And this type of platform will also allow for that, for these differences and that type of customization to be done as well, to suit really the process of care for the patient and the hospital. Now, I'm now going to move to the topic of the patient. So obviously, whenever we think of patient engagement, it's really not just about seeing the patient physically in the hospital. It's also about being able to connect and communicate at a distance. And the way we do that normally is through virtual care platforms. And this is an example of a care platform used in South Africa, for example, whereby the patient can connect with their physician remotely, book appointments, take their medication and order their medication. And it's also about integration with devices. So today, for let's say patients that could be chronic, maybe you need to monitor them continuously, right? So and then you can give them certain devices that will allow them to do that. And an example here is blood monitoring, blood pressure monitoring, for example, whereby you can really provide the care to the patient, monitor them remotely, and at the same time connecting with their care team at the same time. Here's another example also built on the Qualtrics technology from SAP. So it's essentially a remote questionnaire. So for example, here it's a COVID example. You might want to send questions to a full area or district, and then maybe check on certain things for your patient population or your citizen population. So you can send them questionnaires that they can answer remotely. And then from there, get the analytics. And then when you get the analytics, maybe you would want to follow up on individual patients, connect your platforms to your healthcare call centers, or to any type of call center that will allow you to interact with the patient remotely, provide them the care that they need. And then the third one, also on patients, is about communicating with populations at mass, right? So obviously in your population, suppose that you're a public health organization, you have a collection of citizens, right? That fall under your jurisdiction. And then for every group of citizens, sometimes they might have different types of health issues. And then for those citizens, you might want to send them certain communication campaigns or create awareness for them to do certain things. So for example, if you have a population of diabetic people or subpopulation of diabetic patients, for example, that need to take certain measures, let's say in their diet or something of the sort, you can actually use technology to do this for you, right? So by putting them into patient groups and then sending them the right information, communicating the right things, and even maybe communicating at mass. So for example, if I think of the COVID crisis, one of the key things that people needed to be aware of is maybe mask wearing, washing hands and these types of measures. And then technology today allows you to very efficiently do that, right? So I think this is one of the key things that you can use, with SAP technology to be able to communicate and keep these communication channels really open with your patients. I now move on to the topic of people. So on people, obviously, healthcare providers typically have very special challenges due to certain reasons inherent to the public sector industry. And the first one is really the large number of people to be managed, the very wide range of specialities and subspecialties that are needed. So obviously, sometimes a heart doctor is not just a heart doctor, he's a cardiologist with a certain type of expertise, let's say, or maybe he knows to do a certain surgery very well. And then the same applies to nurses or other types of allied health professionals as well. And that creates sometimes difficulties in supply and demand, right? So sometimes you might see a surge in cases, you need to match them with the right expertise. You need to really know where your experts are in a certain country or a certain public sector health system. The third part is also, it's very operationally complex. So sometimes you have, for certain reasons, staff can't work beyond a certain hour, maybe they get sick, and there's a large occupational health risk. And because of this, sometimes it's really hard to know where your people are and where to put them at the right time. So I think that's something, when you do it manually, it's really very, very hard to do. And then technology can really step in and help and, provide an optimal way of doing this. We also have training and education requirements, regulatory requirements. And obviously with COVID-19, there's also more and more an increased focus on the people we have and really caring for these nurses and physicians that are really helping the populations. And if I really wanted to say, if I wanted to simply put in systems, right? So if I wanted to put in systems to help me do my job in healthcare, so what would I focus on? So first of all, shift management and rostering. This is very complex, very difficult. A lot of things need to be put in place, in the background for this to work really well. And then using automation here will allow you to free your staff's time to do better things, right? And then while the technology really kind of focuses on this really complex operation you have. The second part, and this we've seen actually a lot in Europe, is contractors, volunteers, and contingent workers management, right? So sometimes you would need to bring in volunteers, bring in additional staff to help you out, and then you need to manage them administratively in the hospital to ensure safety and to ensure certain things that you need to ensure as a public health provider, essentially. We also can automate areas of talent management and payroll, learning management, that's very important in health, and finally, even feelings and experience management, right? So even areas where we have a human element, technology can step in and help us doing administrative things or things that could be repetitive, giving us the right data and analysis, and then allowing us as managers of healthcare providers to really focus on the core, which is like providing care, ensuring engagement, making sure that we're excellently serving these patients. So here I'm going to also show you a short video, which is about the Carolinas Health System. Now they're called Atrium Health. And these guys have used our SAP technology.
Carolinas Healthcare System is a Charlotte-based healthcare system. It was founded with the idea that everyone in North and South Carolina deserved great care, and that is truly our mission. So we have a really highly engaged workforce that think about their actions every day. They want to be a part of something bigger than themselves. They want to be part of something that creates value for our community. SAP SuccessFactors helps us execute the work in a way that brings energy to teammates, whether it's through advancement of their career or whether through learning a new skill. They're able to use that technology to help create value for themselves. When you're in 900 care locations, you have to create communication channels to work together to understand the mission and to be successful.
The number of applications that we receive a year is over 500,000, and that's continuing to grow.
SAP SuccessFactors helps us connect those individuals through their performance management, through their learning, also through social networks so that they're able to do their jobs more effectively. And we can do it on a remote basis.
The mobile features of SuccessFactors is helpful to our hiring leaders as well as our candidates.
There's 5 generations in the workforce now, and so the technology has to be easy for them to understand and navigate. It has to be something we can execute across the broad range of teammates across multiple locations, and SAP SuccessFactors enables us to do that. We've standardized our forms. We also now have standard database and standard information. And because of that, we're more efficient and we can make better decisions. Before, we were just using our gut and our intuition, and now we had real data to help improve the lives of a teammate or help a management team make better decisions about their processes. And that's really the goal of human resources, to provide a safe environment, an engaging environment for teammates, because we know that when they don't have barriers in front of them to take care of patients, they're going to do a great job. And so the human resources technology is really important to make that happen for us.
So really, it's a multitude of things. So he's speaking about engagement, about feelings, about serving patients. So that's really the core of healthcare, especially healthcare and the government, in my opinion. So really think about how you can use technology to optimize your work and also provide better experience for your employees as well as your patients and your organizations as a whole.
Carolina's healthcare.
Okay. And here's another example from the NHS. And over here, they have used our Qualtrics technology to be able to really build what they call an employee experience program. So what they had at the Imperial College Healthcare NHS Trust is that their employees were not engaged at all, and this was impacting the quality of care that they provided. So they decided to use the Qualtrics technology to be able to really work with, first of all, assess what the core reasons are of this dissatisfaction, and then create a mechanism to have their employees being a lot more engaged. And then the results that they achieved are the following. So 80% of staff were a lot more engaged. They had the highest Net Promoter Score, which basically measures the likelihood of a staff member to recommend the NHS as a good place to work in. So it went up to 72%. They had a 2-level increase in national tables, so they became a better hospital. And finally, they improved in the eyes of the patient as well. So when you took patient surveys, clearly that NHS Trust had a much better care that was being provided to the patients. So thank you very much. I'm very happy to take questions. I have also included my contact details here for you to contact me and then to simply speak or share any ideas that you might have. And we can connect you with a few of our customers that are also abroad for you to see what's the best way to use technology for your organization as well. So please feel free to reach out, and happy to take any questions if anyone has any.
Sure. Thank you so much, Manal, for joining us at Ego8. In a shortage of time, we won't be able to take up any live questions right now. But of course, okay. I request all our delegates to please be in touch with Manal. And if you may have any queries, to please shoot it forward. So thank you so much, Manal, for joining us.
Thank you.
Thank you.
Okay, perfect. Thank you so much.